me discuss the other group of anti-neoplastic drugs, that is the monoclonal antibodies. So if you see this monoclonal antibodies, the very important drug what we have in this monoclonal antibody is the Trastuzumab. Right, the very important drug what you have is the Trastuzumab. Now if you take this Trastuzumab, remember it is a monoclonal antibody against the gene products, that is HER2 or new gene products, right? So this is one of the monoclonal antibody. This particular Trastuzumab, it is against HER2 or new gene product. Now, where is this Trastuzumab used? Remember, Trastuzumab, it is useful for the treatment of the breast carcinoma, but the only problem with the Trastuzumab, why it is having limitations, is the limitations of Trastuzumab is its cardiotoxicity, right? It is used in the treatment of breast carcinoma, right? And if you take the limitations of the Trastuzumab, the limitations are, right, the limitations are the cardiotoxicity. Now this Trastuzumab, so this particular Trastuzumab, recently it has been approved for the cancer of the stomach or the gastroesophageal junction, right? It is useful for the carcinoma of the stomach and as well as the carcinoma of the gastroesophageal junction. Right, carcinoma of the gastroesophageal junction. Now, apart from this particular Trastuzumab, we have one more drug which is called as the Rituximab. Right, we have another drug which is called as Rituximab. Remember, Rituximab, it is also a monoclonal antibody. This particular Rituximab, it is useful for the treatment of non-Hodgkin's lymphoma. Right, useful in the treatment of useful in the treatment of non-Hodgkin's lymphoma. Next, apart from this particular Trastuzumab and as well as Rituximab, we have another monoclonal antibody which is called as Alemtuzumab, right, which is called as Alemtuzumab. Now, if you take this particular Alemtuzumab, remember this Alemtuzumab, it is used for B-cell chronic lymphocytic leukemia, alright, it is useful for B-cell chronic lymphocytic leukemia. Now, apart from this, we have the other drugs, right? The other monoclonal antibodies are, like we have the drugs like Cetuximab, alright, and the other drugs what you have is Panitumumab, right, Panitumumab, and the other drug what we have is Bevacizumab. Right, the other drugs what we have is Bevacizumab. Remember this Cetuximab, Panitumumab, Bevacizumab, these can be used for colorectal carcinoma. Right, these are used for these are useful for the treatment of the colorectal carcinoma, right? So these are some of your monoclonal antibodies. Let me discuss few more. But before that, let me revise. The Trastuzumab, it is a monoclonal antibody. It is the antibody against the HER2 or new gene product. And it is useful for the treatment of breast carcinoma, but due to cardiotoxicity, it is having the limitations. Now recently, it has also been approved for the cancer of the stomach or gastroesophageal junction. And you take the Rituximab. Rituximab, it is a monoclonal antibody useful for non-Hodgkin's lymphoma. And you take the drug that is Alemtuzumab. Alemtuzumab is used for B-cell chronic lymphocytic leukemia, and the other drugs like Cetuximab, Panitumumab, Bevacizumab, they can be useful for the colorectal carcinoma. Now, if you see this particular Cetuximab, right? So if you take this Cetuximab, remember Cetuximab, it is a monoclonal antibody against epithelial growth factor receptor. Right? It is a monoclonal antibody against epithelial growth factor receptor. Now where is this used? Remember, Cetuximab is a drug which is approved for colon cancer, and it is also approved for the head and neck cancer, right? So this Cetuximab, it is the drug which is approved for the colon cancer, but whenever you are giving Cetuximab in case of colon cancer, that has to be given with another drug that is called as irinotecan. Right, the other drug which is called as irinotecan. Not only that, this particular Cetuximab, it is also given in case of the head and neck cancer. Right, also given in case of the head and neck cancer. But whenever you are giving Cetuximab in case of head and neck cancer, you give this with radiation therapy. Alright, you give this with radiation therapy. Now, you take the adverse effects associated with the Cetuximab. Remember, the main adverse effects of this particular Cetuximab, it includes the skin rash, right? The main adverse effects of the Cetuximab, it includes the skin rash, and the other important electrolyte abnormality what you get with the Cetuximab is your hypomagnesemia. Right, the other important electrolyte abnormality is hypomagnesemia, and apart from that, the other important adverse effect is hypersensitivity reactions. Right, the other important abnormality is the hypersensitivity reactions. So that is what you observe with Cetuximab. Next to this particular Cetuximab, like we have discussed a drug called as Panitumumab. Now if you take this particular Panitumumab, remember this particular drug that is Panitumumab, it is a fully human monoclonal antibody against epithelial growth factor receptor. Right? It is a fully human monoclonal antibody against epithelial growth factor receptor. Now remember this Panitumumab, it is similar to that of the Cetuximab, but it do not cause the hypersensitivity reactions which are caused by Cetuximab. Now why it does not cause hypersensitivity reactions? Because this Panitumumab, it is fully human. That is the reason why this Panitumumab will not cause the hypersensitivity reactions. Alright, so this particular drug, it is similar to, right, it is similar to Cetuximab, right, but do not cause the hypersensitivity reactions. right, but do not cause hypersensitivity reactions. Why it will not cause hypersensitivity reactions? Because it is fully human, right, because it is fully human. Now where is this particular Panitumab used, right? Remember, it is approved for colorectal cancer, right? It is approved for the colorectal cancer. So that is about your Panitumab. Now apart from this particular Panitumab, we have another important drug that is called as Bevacizumab, right? If you take this, right, if you take this particular drug that is Bevacizumab, remember Bevacizumab, this is also the monoclonal antibody against vascular endothelial growth factor, right? It is also a monoclonal antibody against vascular endothelial growth factor receptor, right? Now where is this Bevacizumab useful? Remember, this Bevacizumab is an essential requirement. Okay, so you take this vascular endothelial growth factor. Vascular endothelial growth factor, remember, it is very much essential requirement for the angiogenesis, that is for the formation of the new blood vessels. The vascular endothelial growth factor is very much required. So remember, this is essential. So this vascular endothelial growth factor, remember, it is an essential requirement, right? It is an essential requirement for angiogenesis, right? It is an essential requirement for angiogenesis. Now where is this particular Bevacizumab approved for? Remember, this particular Bevacizumab, it is useful for various malignancies. Like, now if you take this Bevacizumab, remember, this is the drug which is approved for colorectal cancer, right? Approved for the colorectal cancer. Also approved for breast carcinoma. Also approved for, right? Also approved for glioblastoma, right? Approved for metastatic renal cell carcinoma, right? Approved for metastatic renal cell carcinoma, and as well as this drug is also approved for non-small cell carcinoma, right? Non-small cell carcinoma of the lung. I mean, in various types of malignancies, this particular Bevacizumab is useful. Now, what is the main concern? Remember, this Bevacizumab, its main safety concerns are hypertension, it can cause thromboembolism, and it has a problem with the wound healing complications, and it can also cause the gastrointestinal perforations. Alright, so if you take the Bevacizumab, remember the main safety concerns. The main safety concerns are, number 1, hypertension, right? Number 2, thromboembolism, right? Number 2, thromboembolism. 3, wound healing complications. Right? 3, wound healing complications. And 4, it can cause gastrointestinal perforation. Right? Gastrointestinal perforation. So these are the safety concerns about your Bevacizumab. So let me shortly revise here what I have discussed. So you take this particular Cetuximab. Cetuximab, remember, it is one of your monoclonal antibody against epithelial growth factor receptor. And where is this approved? This is approved in case of the colon cancer along with irinotecan, and also useful for the head and neck cancer with radiation therapy. The main adverse effects of this Cetuximab is it can cause the skin rash, hypomagnesemia, and as well as hypersensitivity reactions. Next, you take the drug that is Panitumumab. Panitumumab, it is a fully human monoclonal antibody against epithelial growth factor receptor. Now remember, this particular Panitumumab, it is similar to that of Cetuximab but do not cause hypersensitivity reactions. Why it will not cause hypersensitivity reactions? Because it is fully human. And the point is, this panitumumab, it is approved for the colorectal cancer. And if you take this particular other important drug, that is Bevacizumab, it is a monoclonal antibody against the vascular endothelial growth factor. This vascular endothelial growth factor, it is an essential requirement for the angiogenesis. Now, where is this Bevacizumab approved for? It is approved for the colorectal cancer, breast carcinoma, glioblastoma multiforme, metastatic renal cell carcinoma, and as well as the non-small cell lung cancer. Now, the safety concerns of Bevacizumab is that its main safety concerns are hypertension, thromboembolism, wound healing complications, and gastrointestinal perforations. Now, let me tell you in detail about the other important monoclonal antibody, that is Rituximab. Now, let me discuss about the Rituximab. Right, let me discuss about the Rituximab, which is another important monoclonal antibody. Remember, Rituximab, it is a monoclonal antibody which is against the CD20. Right, which is against the CD20. Now, where is this particular Rituximab used for? Remember, it is used in the treatment of the various disorders, and this various disorders, let me give you in the form of a mnemonic, and that particular mnemonic is nothing but Reliance. Alright, so this will be the uses of your Rituximab. Number one, the word R stands for rheumatoid arthritis. Right, the word R, it stands for rheumatoid arthritis. And if you take the word L, that is lupus. Right, it is used in the treatment of systemic lupus erythematosus. And if you take the word I stands for ITP, that is immune thrombocytopenic purpura. And the word A, it is used in the treatment of autoimmune hemolytic anemia. Right, used in the treatment of autoimmune used in the treatment of autoimmune hemolytic anemia. And if you take the word N, used in the treatment of non-Hodgkin's lymphoma. Right, used in the treatment of the non-Hodgkin's lymphoma. And the word C, it stands for CLL, that is chronic lymphocytic leukemia. So these are the uses of the Rituximab. Remember, Rituximab is a monoclonal antibody which is against CD20, right? And these are all the uses of the Rituximab, right? Now what I'll do is, I'll tell you all these particular various monoclonal antibodies, mechanism of action, indications, and as well as their adverse effects associated with that particular monoclonal antibodies. Now let me give you the list of monoclonal antibodies, and let me tell you what are they targeted against, indications, and as well as the adverse effects or the comments about that particular individual drug. So let me take up the monoclonal antibody, and let me tell you they are targeted against, right, targeted against which particular receptor, and coming to the indications of that particular monoclonal antibody, and some of the comments about that particular drug. Now you take the monoclonal antibody, that is Rituximab. Rituximab, remember, it is targeted against the CD20 and it is indicated in case of non-Hodgkin's lymphoma. Not only non-Hodgkin's lymphoma, I have just before this I have given you a list of conditions where the Rituximab can be used. Next, you take another monoclonal antibody, that is Alemtuzumab. Alemtuzumab, it is the target against the CD52. And where is it indicated? It is indicated in case of low-grade lymphomas and chronic lymphocytic leukemia. Next, you take Trastuzumab. Trastuzumab, the target it is against HER2 or new receptors, and it is indicated in case of breast carcinoma, but the problem with the Trastuzumab is it can cause the cardiotoxicity. Alright. Next, you take another monoclonal antibody, that is Cetuximab and as well as Antineoplastic. These two drugs that target against EGFR, that is epithelial growth factor receptor, and if you take the indications, they are indicated in case of EGFR positive metastatic colorectal carcinoma. Adverse effects is these drugs can cause rash, hypomagnesemia and interstitial lung disease. That is about these two drugs, that is Cetuximab and as well as Antineoplastic. Next, you take the other drug, that is Bevacizumab. This Bevacizumab, the target it is against the vascular endothelial growth factor, and indications are in case of metastatic colorectal carcinoma, and this particular Bevacizumab, it is combined with another important substance that is called 5-fluorouracil. Next, you take another important monoclonal antibody, that is Trastuzumab. Remember, we have two drugs here, Trastuzumab and as well as 𝐒𝐮𝐬𝐫𝐞. Trastuzumab and as well as 𝗂𝐨𝐫𝐞, these drugs, the target it is against the CD33, and where is it indicated in case of CD33 positive acute myeloid leukemia, right? Next, you take the another important monoclonal antibody, that is Trastuzumab and as well as Ibritumumab. These two drugs, that is Trastuzumab and as well as Ibritumumab, the target it is against the CD20, and where is it indicated? Indicated in case of relapsed lymphomas, right? And these two drugs, that is Trastuzumab and as well as Ibritumumab, they are conjugated with radioisotopes. Now for example, you take the Trastuzumab. Trastuzumab, it is conjugated with the radioisotope, that is iodine-131, whereas you take the other drug, that is Ibritumumab, it is conjugated with the radioisotope that is of yttrium. Alright. Next, you take the another important monoclonal antibody, that is Denileukin-diftitox. This Denileukin-diftitox, if you take the indication of this particular drug, in case of recurrent cutaneous T-cell lymphoma, we use this particular Denileukin-diftitox. And the comments about this particular Denileukin is that it is a recombinant interleukin 2 plus diphtheria toxin, right? Next, you take another important monoclonal antibody, that is Denosumab. Denosumab, the target it is against RANKL, right? The target it is against RANKL, and indications are in case of giant cell tumor of the bone, and it is also used in case of osteoporosis. Next, you take another important monoclonal antibody, that is Obinutuzumab. This Obinutuzumab, it is the target it is against the CD20, and the indications are in case of chronic lymphocytic leukemia, and remember, it is used in combination with chlorambucil, right? Used in combination with chlorambucil. Next, you take another important monoclonal antibody, that is Pertuzumab. Pertuzumab, the target it is against HER2, indications are for breast cancer. What it will do is, if you take the comments about this Pertuzumab, it inhibits the demineralization of HER2 with other HER receptors. Alright. Next, you take another important monoclonal antibody, that is Ipilimumab. Ipilimumab, the target it is against the CTLA4, and indications are malignant melanoma. Next, you take another important monoclonal antibody, that is Ramucirumab. Ramucirumab, the target is against the vascular endothelial growth factor receptor 2, and the indications are for gastroesophageal adenocarcinoma and as well as non-small cell lung carcinoma. And where does it act? This Ramucirumab, it acts as the angiogenesis inhibitor. So that is about your Ramucirumab. Now we have another monoclonal antibody like nivolumab. This nivolumab, the target it is against PD-1 and the indications are non-small cell lung cancer and metastatic melanoma. And the comments are this nivolumab inhibits interaction of PD-1 with ligands on T cell. Alright, next you take another important monoclonal antibody, that is Dinutuximab. This Dinutuximab, the target it is against the glycolipid GD2. The indications are indicated in case of children with high risk neuroblastoma. And if you take the comments about that particular Dinutuximab, used in combination with GM-CSF, interleukin 2 and retinoic acid. So that is about your Dinutuximab. Next another important drug what we have is Blinatumomab. This Blinatumomab, the target it is against CD19 and CD3. And the indications of this particular Blinatumomab is indicated in case of Philadelphia negative B-cell acute lymphoid leukemia. Next, the another important monoclonal antibody, that is Pembrolizumab. This Pembrolizumab, remember the target it is against the PD-1 and the indicated in case of metastatic melanoma. So these are all the various monoclonal antibodies and their respective indications.